If you're feeling tired all the time, well, the culprit could be your sleeping pattern. But not to fear, something can be done. Dr. Thomas LoRusso, the medical director of the Northern Virginia Sleep Diagnostic Center, is here with us today to help us with our sleeping habits. Welcome, Dr. LoRusso.
Thanks for having me.
Good to come in today. Now, we're not talking about the occasional sleepless night here, are we? We're talking about the repeating night after night, tossing and turning. Is this a big problem?
Yeah, it's a major problem. I mean, up to 50% of people at one point in their life will be complaining of either trouble, difficulty getting to sleep.
50%?
Up to 50%. And it's actually twice as common in women, things like trouble getting to bed or maintenance of sleep. We know in women, for example, that a lot of it has to do with the hormonal changes that occur over the course of a lifetime. Menstrual cycle, the changes in hormones, a lot of problems with sleep during that period. Pregnancy is another time where sleep deteriorates, and then menopause. There's a huge spike in sleep problems in women.
So women have it worse than men.
Yes.
And what about men as far as stress levels goes? Does that interfere with sleep patterns?
Yeah, I mean, stress in both men and women is a very common cause of difficulties maintaining sleep. What you'll also see in men a little more commonly is something called sleep apnea, a problem where they're actually snoring loudly and they stop breathing at night, and that can really influence a good quality sleep.
So what can you do for someone who comes in to be treated for a sleep abnormality?
Well, the first thing you want to do is identify what the problem is. There are a number of specific causes. You want to look at medications. There are a number of medications that people take for asthma, decongestants that can really trigger problems with sleep. Are they drinking a lot of caffeine? Do they exercise but not too close to bedtime? And do they have a comfortable sleep environment? There's some people that do a lot of work in their bed. They have the TV on. They're worrying about things in the bed. That's really not a conducive environment for sleep.
So are there pre-sleeping rituals that you kind of help people with?
Yeah, I think one of the things you want to do is have kind of a relaxing sleep environment. So reading is not a bad idea. Do a little reading before. Make sure when you're ready to go to bed, the lights are out. Try to leave your worries outside the bedroom. I'll sometimes tell people to write down what the problems of the day are going to be the next day. Try to move them out of the bedroom. And really, the bedroom really should be for sleep and intimacy and not rolling around. If you're not sleeping in the bed, you're better off getting out for a short period of time. Get tired, go back in the bed.
Sounds good, but then you still might have a problem. You know?
Yes, yeah.
And so then in those cases, what help do you have?
Well, if all the sleep hygiene is correctly done, then you sometimes have to try medication, okay? There are roles, particularly with chronic insomnia that's been going on more than 6 weeks, where medications can be quite effective, and they help both get people to sleep and maintain sleep.
All right, well, we appreciate you coming in to talk about sleep patterns, and hopefully people will get a better night's rest.
Thanks.
Dr. Thomas LoRusso, thanks so much.